Namaste everyone, I am Dr. Ankita Sawan. Welcome back to my channel Physio Vitals, and today we are diving into a condition that affects many people, especially as they age, which is known as cervical spondylosis. So this condition, also known as cervical osteoarthritis, can cause the neck pain, stiffness and even impact the arm and hand function. By the end of this video, you'll have a comprehensive understanding of cervical spondylosis, its cause, symptoms, and most importantly, how physiotherapy can play a crucial role in managing and alleviating these symptoms. So let's get started. So the cervical spondylosis is a common age-related condition which affects the cervical spine, causing stiffness and pain and nerve compression. So let's first see the anatomy. So the cervical spine consists of the 7 vertebrae labeled from C1 through C7. So we have 7 cervical vertebrae. So these vertebrae provide support and flexibility, allowing the neck to move and bear the weight of the head. So between each vertebrae there are discs that act as cushions. That cushions act as a shock absorber and maintains the flexibility. So surrounding these structures, we have ligaments, muscles and nerves that enable neck movement, stability and communication with the rest of the body. So we saw that cervical spine consists of 7 vertebrae C1 to C7, provides the support and mobility to the neck. We have intervertebral discs. So these discs act as a shock absorber between the vertebrae, allowing for the smooth movement and preventing bone-on-bone contact. The nerves. Cervical spine houses the spinal cord and nerve roots that control movement and sensation in the head, neck, arms and hands. Now we'll see the physiology of the cervical spine. So the cervical spine houses the spinal cord and the nerve roots that exit between each vertebra to control the sensation and movement in the upper body. The intervertebral discs absorb pressure and allow the vertebra to move smoothly. Muscles in the cervical region support head posture and ligament, limit excessive movement to prevent injury. So over time, however, these structures undergo natural wear and tear, potentially leading to conditions like cervical spondylosis. So the movement in the cervical spine which permits us is flexion extension. The cervical spine allows for the flexion, that is bending forward, and extension, that is bending backward of the neck. Cervical spine also permits rotation. So the cervical spine enables the rotation, which is the turning of the head from side to side. Then another motion is lateral flexion. Lateral flexion refers to the movement of the neck to side, allowing for tilting the head left and right. Moving further to the pathophysiology. Pathophysiology of the cervical spondylosis. So it develops mainly due to age-related degeneration of the intervertebral discs and the vertebra. So this degeneration results in dehydration and shrinking of the discs, causing the vertebra to rub together, which can lead to the formation of bony spurs or the osteophytes. These bony growths can compress the nerve, which leads to pain, stiffness and sometimes numbness or weakness in the arms and the hands. In some cases, the spinal cord itself may be compressed, causing more severe symptoms. So the other contributing factors are the poor posture can lead to cervical spondylosis. Repetitive neck movement can cause cervical spondylosis. Injuries to trauma can cause cervical spondylosis, or the genetic predisposition. Now we'll see the assessment. So, clinical history and examination. Patients interview to understand the symptom onset and any aggravating factors. Assessment of neck mobility to identify limitations in range of motions. Then palpation of the cervical spine to detect the areas of tenderness or any muscle spasm. You have to see, thorough observation should be done. Is there any hump in the cervical? The proper contours or the posture of the cervical spine is maintained or not? Is there any swelling, redness, any muscle spasm while assessing? All these things you have to note. Then perform the special test. Sperling's test to identify the nerve compression. Distraction test to assess the relief of the nerve root symptoms when traction is applied. Neck compression test to determine if symptoms worsen with axial loading. So in distraction test, the patient will be sitting on the examination table. You will be standing perpendicular to the patient. One hand of yours will be beneath the chin of the patient and the other beneath the occiput. You have to lift the head up in order to distract it from the neck, and if the patient says that his or her symptoms are relieved, that means this distraction test is positive. Likewise, neck compression test. For compression test, you have to stand behind the patient and the patient will be sitting on the examination table. You have to compress the neck downward, and if the patient says the symptoms are worsened, that means the compression test is positive. Then we have to do the imagings as well, like X-rays, MRIs or CT scans are often used to confirm the cervical spondylosis and assess the severity of disc degeneration, osteophytes and any nerve impingement. Then history. Thorough history is really important. Ask about symptoms, onset, duration and any aggravating factors. Physical examination, assessing range of motion, muscle strength, reflexes, sensory functions. Imaging, as I said, X-rays, MRI, CT scans provide the detailed images of the cervical spine to identify the extent of degeneration and nerve compression. So proper assessment should be there. If you have any doubt about assessment, you can approach in the comment section. I'll be providing you personally the details of the assessment. Moving further to the conservative treatment. So first, the medical management: NSAIDs, non-steroidal anti-inflammatory drugs and pain relief medications. Then muscle relaxants to relieve spasm, epidural steroidal injections in cases with the severe nerve compression. Surgical intervention is also an option, but surgery is usually the last resort. So which indicates only in cases of severe pain or neurological symptoms that don't respond to conservative treatment. Okay, now, so first approach conservatively is pain management. Symptomatic treatment should be there, over the counter and prescription. Pain relievers can help manage pain and inflammation. Physiotherapy will be covering up next. Lifestyle modification, healthy weight, good posture, ergonomic practices can reduce the strain on the cervical spine. Now, very important part of this particular lecture is role of physiotherapy or physiotherapy treatment strategies. So now let's focus on the physiotherapy, which is essential for improving mobility, reducing pain and enhancing function. Here's a detailed look of the physiotherapy management of cervical spondylosis. First, we'll do, as a physiotherapist, you need to see the pain relief techniques. Heat or cold therapy. So that should be decided. Apply heat to relax the muscle or cold to reduce the inflammation in acute phases. Hot packs in chronic phases, and always in acute phases cold pack should be used. Then ultrasound therapy helps reduce deep tissue inflammation. So ultrasound therapy helps to reduce deep tissue inflammation. TENS, transcutaneous electrical nerve stimulation, a non-invasive method that blocks pain signals and encourages endorphin release. Manual therapy techniques, in that cervical traction helps to relieve nerve root compression by gently separating vertebrae. Then joint mobilization, which increases the joint range of motion, reduces the stiffness and relieves the pain. Soft tissue mobilization reduces muscle tension and improves blood flow. Moving further to the stretching exercise. Upper trapezius stretch should be applied. If you want any stretching video, I'll be uploading it in coming future in my shorts. So you can see the stretching video in my shorts, YouTube shorts. So stretching exercises: upper trapezius stretch, gently tilt the head to stretch the trapezius muscle. Then levator scapulae stretches, which helps relieve the tension in the levator scapulae muscle. Then chin tuck exercises to strengthen the deep neck flexors and improve the cervical alignment. Then we'll come to the cervical strengthening part. Strengthening exercises may we need first to concentrate on the isometric neck exercises. So builds the strength without straining the joint. Scapular stabilization exercises like shoulder blade squeezes enhance the support for the upper back muscles. Resisted neck flexion and extension exercises which you can use by hand or any resistance band to build the neck muscle strength. Postural education, very much important. Educate your patients on maintaining the correct posture, especially while working at a desk or on a computer. Proper posture minimizes the cervical spine stress and prevents further degeneration. Aerobic conditioning, gentle aerobic exercises like walking or stationary biking can help improve circulation, reduce the inflammation and enhance the general fitness. Home exercise program is very much important. Before discharging any patient, whether the patient has taken 15 days or one month package, before discharging the patient from your clinics or your setups or hospital, home exercise program should be explained properly end to end. So encourage the patient to maintain a regular home exercise program to continue strengthening and flexibility. Okay, then enhance adherence to the routine that includes stretching and posture correction exercise. So a quick recap. First, pain relief techniques, heat cold, ultrasound therapy or TENS if required. I'm just giving a general. You have to choose any one or two of these. Not everything you have to try on patient. Okay. So cold packs, hot packs according to the phases, acute, chronic, ultrasound therapy, TENS, pain relief. Then we'll come to manual therapy techniques, adjunct, cervical traction, joint mobilization, soft tissue mobilizations, stretching exercises may upper trapezius, levator scapular stretch, chin tucks. In strengthening exercises, isometric neck exercises you need to give, scapular stabilization you need to do, resisted neck flexion extension exercises you need to give, postural correction or education, aerobic conditioning like walking, stationary biking, improve the circulation, home program. Whenever you see the patient as a whole. Okay, so if the patient is localizing the pain, don't just be confined to that particular area only. Assess the proximal and the distal part as well. See the patient as a whole, then only you will get a good insight about what exact the problem is. You should be you should create such a vision that you should know what the you should get the idea of what the problem is, root cause of the problem you should know. Okay, so see the patient as a whole, then only you will be able to treat any patient effectively. So that was all about. So to sum up, the cervical spondylosis is a common condition, especially in older adults. So it can cause significant discomfort and even impact daily activities. But with proper management, particularly through physiotherapy, it is possible to reduce symptoms and improve quality of life. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more such videos on health and physiotherapy topics. So thank you for watching and I'll see you in the next video. Keep learning. God bless you all. Thank you very much.